You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. Dental implants is our discussion today. Also, cosmetic dentures. With us, we have an expert on the topic, Dr. Holtan. Dr. Holtan, welcome to the program.
Thanks for having me, Randy.
Now, before we get into today's topic, we also have your partner coming on the second half to talk to the denture wearers that are going to consider dental implants. But for people that don't know you, who's the typical patient? What are the different procedures that you do?
Randy, we really don't have a typical patient. We help people from all walks of life. As you know, Southwest Florida is a very diverse community. We have people that are in their 20s that have just moved to town, and also more mature folks that are starting to have problems as they age and their teeth tend to wear out. We do all types of dentistry. The focus of the practices is dental implants and what we call restorative dentistry, which is what you think of with crowns and bridges and dentures and really implant solutions.
Okay, good. Now, on the second half of the show, if people are tuning in, you know, I said especially no more dentures. And we're going to talk about the options for denture wearers to get a fixed set of teeth with as little as 4 or 6 implants. Is that correct?
Absolutely.
Okay. Are you seeing a lot of these denture wearers that...
We see a ton of denture wearers based on where we live. As you know, a lot of people had their teeth removed when they were younger, and they've worked with dentures their whole life, and it's worked for them to a degree. And they have started to pursue the new things that technology has afforded them. They come into the practice and they want to find out what we can do for them. Maybe their dentist didn't really know what they could be done. We basically use some of the advanced technology we have, our CT scanning machines, and really with what we know about implants now. And because things have changed and progressed, we're able to find ways for these folks to get some teeth that stay in their mouth, that are functional, that look great, and really bring back all the things that they've been missing for years.
Let's talk about your background and training. I mean, how you got into this. I guess you have a family of physicians. I guess your sister, your father is a medical doctor. How'd you pick dentistry?
Really, I wanted to be a doctor from the time I was a child. And as that kind of developed, I realized that dentistry had a really more to offer for me. I like working with my hands, I like technology, and really like helping folks get something and get it done. I think with medicine these days, there's so many challenges to really helping people in the way in which a doctor may think is best for them. And in dentistry, we're able to give people all the things they want. There's literally nothing that we can't do. It just really depends how much time and effort it takes.
You say you're changing people's lives. You told me that on the telephone.
Absolutely. I mean,
with like dental implants or cosmetic dentures or facelift dentures?
Really everything. It depends what someone's problem is. When they come to me with a chief complaint that, you know, I can't chew, I can't smile, my teeth are falling out of my mouth, to get them teeth that stay in their mouth, that are functional, and that look great, changes everything.
What do they tell you?
They tell me, I can't believe this happened. I can't believe this was even an option for me. Nobody ever told me I could have this done. And really, you know, you talk about spouses, you talk about children, and really grandchildren. I mean, think about people that have grandkids and they're having tooth problems, and when a 4-year-old child can tell you that there's something wrong, you know that, okay, it's time to get something fixed.
So you have this, I guess, approach where you do everything under one roof, you say. Elaborate on that. What does that mean?
I think Dr. Molzan and I have a particular set of skills. We consider ourselves implant dentists, but we're also general dentists. So what we're able to do is do both parts of the implant really process. We're surgeons. We take teeth out, we put implants in, and we also hook those teeth up to beautiful porcelain teeth, dentures, teeth that stay in their mouth.
So they stay there in your practice? They
Absolutely,
don't go out.
absolutely.
Okay.
There's really no reason that we have to send people somewhere else to have the job done. We have an anesthesia team that helps us sedate people, keep them very comfortable while we're focused on working on them. And really, they'll only have to come to us to have the entire process done. I think because of that, we're able to offer a more reasonable fee and really get the job done faster.
Is that right? Now you also, I guess you're both licensed to do IV sedation.
Absolutely.
Do people like that? I mean, people want to be just out for the procedure?
Absolutely.
Is it safe?
Absolutely. Very safe. We have an anesthesia team, like I said, that is there watching the patient the whole time, and I'm focusing really on doing the procedure. And really, when you talk about getting this stuff done, it's not that people can't have it done with the free shots and things like that people have done in the past. It's so much more comfortable to come to the office, to not remember the procedure, and really not to experience any of the bad with implants.
Okay.
You know, people have associated implants with pain and things like that. So much has changed, and really the anesthesia is a major part of helping people reduce those barriers to treatment.
Okay, good. Now we're going to move on to the topic, and for people just tuning in, we're talking about no more dentures, get a fixed set of teeth with dental implants, but we're also, before we get into that, we're talking to Dr. Holtan here about these, I'm calling them cosmetic dentures. You call them facelift dentures. I was skeptical. You sent me the brochure. I looked at it, and it was pretty good. Because I feel like I could spot dentures walking down the street. So who's the typical patient that's coming in for cosmetic
The typical patient
or facelift dentures, as you
that
call
I see for facelift dentures, like you said, is someone that's had dentures for a really long time, or has just recently transitioned to them and they hate the way they look. Okay, and dentures have been done the same way for years and years, and there's really been no major technological breakthroughs, really until now, I think. And the facelift process is a technique where I spend as much time making a set of dentures as I would on a beautiful, crown and bridge case redoing someone's whole smile.
Okay.
We look at everything. Okay, we look at where the teeth lie in the face and how we support the lips, looking at their side profile, and really optimizing exactly what we think the patient wants to look like.
And they're not that much more than a traditional denture, is that correct?
No, not at all. Absolutely. It's
Okay.
it's an affordable process. Like I said, adding to the procedure with implants and things like that will certainly make it cost more.
Okay.
I think the benefits really outweigh the cost and the investment.
You brought photos.
I brought a lot of photos here.
What are we
today,
looking
actually. This particular patient came from the facelift denture people, and look at the before. One of the things you'll
So this
notice,
is not your patient.
this is not a
but
patient
it's a
of mine.
sample of
This is a sample of what the
dent-
process
okay.
can do. What you'll notice is very thin lips. The face appears short, and really you don't even see any teeth there.
Okay.
Why are people smiling? It's because you want to show their teeth, show how happy they are, show really that you're an excitable, enjoying person. And with this particular patient, you can't wait till you see the after, but look at her lips. Look at the space between the lips. There's almost no room for teeth there because her bite has been collapsed, okay? These dentures were made very long time ago. It looks like kind of gray, and if you see the corners of her lips, even kind of look like they're almost one. Absolutely.
Okay. So
And,
on this after, this is the same lady? Obviously.
it is the same lady. I mean, when you look at that picture, tell me how old you think she might have been when you first glanced at it.
Well, she definitely looks younger, 10 years younger or more on the after or on the before than she does in the after.
Absolutely.
So is it because of the dentures supporting the lips, pushing them out?
The dentures supporting lips and supporting the face. These teeth were able to move them a little further forward.
But her
Okay.
nose is picked up. Did you see that?
In the side profile a little bit, we're able to add a little bit more support. It makes the lip not appear so thin. It's almost like having some of those plastic surgery procedures to the face. So the facelift denture name comes in because really we're able to give people with just a new set of teeth a lot of the things that traditional plastic surgery can do for them.
Okay, because it sounds like an exaggeration, facelift dentures, but when you look at the before and after, obviously it looks good.
One of the things we're very focused on is results, okay? And the way the process works is that before the teeth are ever delivered, we get to see them in your mouth. I take a big picture, we put it on the big plasma screen, and we can talk about it. We talk about it with a spouse, talk about it with somebody that may have a little more inference in their life, and to see that before we have the teeth made, it really goes a long ways in making it predictable and getting the results that we want.
Is it men and women?
Men and women, absolutely.
Mostly
I find
women that are coming to do this?
Mostly women. I mean, predominantly aesthetic needs are with the female
Guys
population.
put things off, you
but
think?
I have had many male patients who it has done a lot for their lives. In fact, if we look at John here, this is another particular patient.
This is one of your patients.
You focus on that smile. He may be smiling in that pre-op photo, but I really had to work hard to get him to do that. Okay, these people
right?
come into your practice and they don't want to smile. They're not used to smiling. They may not have smiled for 10 years. Their teeth have either been lost to some traumatic accident or they are just in disrepair. And to get a pre-op photo, I think shows a lot about what I can do for them.
So did he look mean?
No,
I mean, like a mad guy before?
He
I
kind
mean,
of
because
looks
if
like
you're
a,
not
he kind
smiling.
of looks like a grumpy old man. Like you said,
Okay.
if you're walking down the street and he flashes you a smile, you may not think the same thing he's thinking.
Okay.
I think when you see in the after, he's got such a pleasant
Wow.
smile. We're able to show the right amount of tooth for a more mature gentleman. We don't need the teeth hanging out over the lower lip, but certainly you want to show white.
Is
okay?
that are those dental implants or
These
those?
are dental implants, yep, and we actually cemented these in his mouth, so those
That's
stay
a
in
fixed
there.
set of teeth.
That's a fixed set of teeth. We can do that with as little as 4 implants. Sometimes we decide to use more based on the particular patient and what they need. But really, when you talk about smile design and making these teeth look good for people like this, longer teeth look more youthful. They look like the way he really should be. Nobody will know that gentleman has fake teeth.
Very nice. And they can eat and chew whatever they want.
Eat and chew whatever they want. Absolutely, it's very common.
How soon can they eat?
Usually that day. I mean, we're very progressive implant dentists. We try to get people teeth the day they leave the office. So no matter what phase of the process we're in, if bad teeth are coming out, we're putting implants in on day 1, you're always going to go home with
Very
a set of teeth.
painful though. It seems very painful.
See, and
You say it's not painful.
that's probably the most common misconception I hear from folks is that, is this going to hurt? What's it going to feel like? In fact, I had 2 patients yesterday that we talked about it at the post-operative visit. They didn't even take the pain med I gave them. In fact, one of them took 1 ibuprofen that night, and that was it. So things are done differently now. We're able to do things in a more minimally invasive way.
How old could you be, by the way?
The oldest patient we've treated in our practice is 95 years old.
Interesting.
So there is no
Wow.
limit to this. Just like with any implant procedure, there's very few contraindications to helping these people.
Okay. Now we're just about to move into specifically dental implants, and you have another facelift denture
Absolutely.
photo,
With this-
and that's all we have time for.
Look at just the before for this particular
Okay.
patient. If you see that, this is the most common look that I see. The bone loss has occurred in the upper jaw first. The bone is a little weaker.
This is not
there.
your patient, but it's from the company that makes these dentures.
And this is a perfect example of really the people we see. You know, people that are in the community, they don't want you showing pictures of them looking like this. They like showing us the after pictures. What you'll notice with this particular patient is the very typical denture look. Flat teeth, a little yellow, a little aged, and a little short. What does that all show? It shows age. And this is the thing we're trying to avoid. If you look, and I can't wait to show you the after.
Very nice.
When you see that, look at how much more teeth this particular woman is showing. Even flashing as half of a smile as she did in the
Yeah.
pre-op photo, she's got the most gorgeous smile, a very broad reveal.
She looks younger, there's no doubt about it.
Absolutely, making those teeth follow the lower lip
And those
line.
are just dentures.
These are just dentures.
You call them facelift dentures.
These are facelift dentures, absolutely.
Okay, and yeah, it's very, very impressive. I mean, she looks younger. I mean, she could almost look like the mother of her before.
Absolutely, and you know, when you look at these things, yes, dentures can accomplish all this, and you want to take it to the next level. We're able to add implant support, whether it's snap on, snap out, or you know, teeth that maybe stay in your mouth all the time. These things all just take the look to the next level.
So when people go to your office, okay, so they're missing teeth, they're denture wearers.
Mm-hmm.
You're going to offer them a less expensive option of these cosmetic facelift dentures, or something secured by dental implants. Is that the way you do it?
Absolutely. I think every patient really gets to make the decision what will work best for them. And really, I like to break it down to 3 options. There's teeth that stay in your mouth all the time. There's teeth that come in and out of your mouth. It could be a facelift denture that may snap on, snap out to some implants. And then there's teeth that aren't supported by implants but come in and out of their mouth. And usually based on all 3 of those, people are able to identify for themselves what will work best for them. Was my problem with chewing, or do I just want to look better? And then from there we can create a plan and really get them back to smiling and just living their life.
And you love this.
I love this stuff. Do
you think you have a better life than your family of the medical doctors?
Absolutely.
I mean, more rewarding wise.
Absolutely. I think helping people with these kinds of things makes such a change in their life that, again, the results speak for themselves.
Good for you. Well, I want to thank you for coming on the show. We're going to have your partner. We're talking up next, no more dentures. Get a fixed set of teeth with just a few implants. Thank you for coming on the show. Very interesting.
Absolutely.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. We're discussing dental implants today. According to my first guest, with 2, 4, 6, or 8 dental implants, you could get a fixed set of teeth or something that snaps in, snaps out. With us, we have Dr. Molzan. Dr. Molzan, welcome to the program.
All right, thank you, Randy, for having me.
Now, for people that don't know you, we had your partner on the show talking about the cosmetic or facelift dentures.
Yes.
And you do a lot of dental implants.
Yes.
In the practice, but tell me about your practice, because I guess you do kind of everything under one roof. You have this concept.
Well, Randy, we really don't have a typical patient. It's a general dental practice where we serve all the needs of anyone who comes in the door. The vast majority of our patients in the practice are usually a more mature patient. So we're dealing with a more mature patient who has a variety of different dental needs. Anything from getting their teeth cleaned to having their mouth reconstructed or re-engineered to have.
So you say
solid
mature,
teeth.
like what age range? 50, 60, 70, 80s?
We go all the way up to 100. I think the eldest gal that I was able to help with a dental implant was 97 years old.
Really, with dental implant? Why would they want to do that at that age?
Well, Randy, they want to be able to eat and chew, just like you.
Are they more likely to fall out, it seems like, at that age?
No,
older?
the scientific studies have shown that that's not the case, that implants work in teenagers as well as into the people into their 90s.
Okay, good. Now, you've been doing dental implants for a long time.
Yeah, I hate to admit that. I've been doing them now 32 years.
And you say it doesn't hurt.
Well, no. Obviously, having dentistry done has some degree of soreness and stuff, but things have changed light years from when I started doing it 32 years ago and where it is today. I mean, nowadays we don't even have to make an incision a lot of times. We can make our little penetrations and do our things without making a cut in the gum, meaning no sutures and a very, very quick recovery back to normal life.
So what are the categories of dental implant patients that you see? If you had to categorize them.
Well, let's start with the easiest one. The easiest one is someone who's lost a tooth, broken a tooth, had a root canal that's gone bad, and the tooth now has to come out. In today's world, we can slip the tooth out, drop the implant in, put a temporary on top of it, protect it, let it heal, and then finalize it.
But same day they can walk out with a tooth?
Same day they walk out with a tooth.
Right.
Yep, it's phenomenal. The change has happened in the last 10 years has been just light years from where we used to be. And then you've got folks who are having to lose a section of teeth or have lost a section of teeth. So they're missing 3, 4, 5 teeth, something like that. So you have to rebuild a section. And the question becomes, all the patients ask, do I need an implant for each one? And the answer to that is no. Many times you can strategically position an implant or a tooth root and from there fabricate a set of teeth that go right on top of it that feel and look and work just like natural teeth. But the majority of our practice focuses on people who have really bad teeth and it's now that point in time where they have to go ahead and do something. So they're probably going to lose their teeth and they're going to come in and get a new set of teeth. There's dentures as one option, but implants are the better way to go, where we can place some implants and we can put teeth right on top of it that very same day.
What if they have bad gums, though? I've been told that. I've heard that from somebody. They say, my gums are too bad, Randy.
Well, people who have bad gums are candidates because once we remove the teeth, the gum problem goes away. The infection goes with the teeth. So you've got a situation there where you're back to ground zero or back to a healthy environment where you can then place dental implants and make them work. And then a great portion of the patients coming to our practice are denture wearers. People who've had their teeth for 20, 30 years. And now they're not working. They're sore, they're moving around, they're everywhere. We can very easily use 2, 4, 6 implants to stabilize those teeth, and we can even make them where they don't come out. So with a couple of implants, we can stabilize them. If we utilize more implants, we can actually make
like
teeth
2 implants to snap in and snap out.
Yeah, have the teeth that will just snap in and snap out and quit moving around.
Okay, and then what if they want a full arch of teeth? Like
Well,
a fixed set of teeth?
then obviously you're going to need a couple more implants.
Like 4 or
there's
6?
There's the all-on 4, the all-on 6 procedure. There's a variety of different ways that we can accomplish it. Once you provide enough support, you just anchor the teeth to the implants. That's what the implants do. They provide an anchorage, a support system, and we make teeth that go on top of them.
Did they ever tell you what they could eat?
Oh yeah.
Like eating stories?
Oh, the eating stories are
Could they eat
always-
a steak? I mean,
oh, absolutely. That's one of the first things they do is I bit an apple. I never thought I'd be able to bite an apple again. I had corn on the cob. I bit into corn. I've been cutting it off with a knife for my whole life. He goes, it's amazing. And then of course the meals. But it's not just the steaks. It's the vegetables. It's the raw vegetables that they get to use. Because, we're all, as we mature down the road, we start getting a little older and we got to start eating healthy. We can't eat just the red meats and things. And that's where a lot of the denture people suffer. They can't do vegetables unless they're way overcooked. When they go out to eat, the denture wearer decides what they're going to select for dinner based on what they can chew.
Is that right?
Yeah.
They tell you that?
Yeah. And so now once you stabilize and give them teeth that are anchored back to the jawbone again, they don't have to do that anymore. They can pick what they want. It's a great way to go.
Have people ever been turned away or told at other dentists, dental offices, you don't have enough bone and you've done them? Does that ever come up?
Randy, absolutely. That's one of the most common things that we get in our practice.
Like what, once a month?
Oh no, once a week. Because
Really?
we've been
Once
doing
a
implants.
week?
Absolutely. We've been doing implants for 32 years, so we kind of get the second opinions coming in to ask, my dentist said I can't do it. There's not enough. And we hear them from, we hear that once a week. And once you do, again, you take
What
the
do you think about that when you hear that? Is it frustrating, or are you just happy they ended up with you?
You just feel for the patient. I mean, it just depends upon the clinician's education level. But again, the magic of these new systems, the CT, you take the CT and it tells you exactly what the patient has, and you don't have to guess. So the guesswork goes out the window. So you can tell a patient exactly at that first visit what's going to go on and how it's going to happen and whether they're a candidate, because that's what they first want to know. They want to first, am I a candidate? And then what are my options? And then how's it going to work? What's it going to cost? All those things that are important too. But most just don't know that they're a candidate. They want to know if they're a candidate.
Now, for the sake of time, you brought photos.
Yes, I did.
So what are we looking at here?
Well, we've got a gal. Let me pass this over.
Okay. Oh my goodness.
who's got some really bad teeth that have absolutely impacted her life. She walked around, never smiled.
That's got to be unusual, though. That has to be unusual.
Well, Randy, it's not. Believe it or not. That happens a lot, but you don't know it because they never smile.
Okay.
You walk down the street and those people have their lip down there. They're not showing a darn thing. And so that happens quite a bit, and you just don't know it. So that's out there. Well, she was in a spot where those teeth were just so bad they had to go.
Okay.
So in one visit, the teeth were removed. We were able to insert some new teeth that look and function just great. Now, we're going to let her heal up, and after she heals up, her teeth were so bad, we're going to come back after the fact and put her dental implants in and fasten those same teeth to the dental implants. But
Will that be something that snaps in and snaps out?
With her, it's going to stay in full time. She wanted to have teeth that don't come out.
She's a young person.
She's a young person. And you can only imagine how that impacted her life as she went through. Let's say you were going to hire her for a restaurant. Or a
job, or any kind of a job.
Any kind of job. Which one are you going to hire?
You hire the one that at least looks happy and smiling.
Yeah, well,
right?
Look at the eyes. The eyes are different. That's where you see the difference. She's a pretty sad gal in that first picture with the bad teeth, but look at her eyes in the second picture.
You said they have to learn to smile. What do you mean? What do you mean by that?
Well, they do. They've forced over the last X number of years to keep that lip down.
And those look natural, by the way. People need to know it's a real interview. I'm not siding with you. I'm just asking you the questions here. But those look like real teeth. Because I feel like I could spot dentures.
Well,
it's one of the things I can do.
I think you'd have a hard time with this one.
Yeah, no, it looks good.
The magic is bringing the front two teeth down just a tad, making sure the eye teeth are down, following the lip line. There's implant dentistry per se is only a vehicle to giving people strong, healthy teeth that last a long time. That's the magic of implants. Doing the implants people don't want. They want teeth that allow them to smile, chew, feel good about themselves, and function daily without being nervous about, are my teeth going to move? Are they going to fall out? Are they going to slip?
Look, I know a couple of denture wearers. They seem to be okay. I mean, is there such a thing as a happy denture wearer?
Oh, absolutely. There's happy people.
Okay.
There's happy people and unhappy people.
But you don't think they know what they're missing?
They don't know what they're missing. They don't know what they're missing. That's the point.
They all would come in if they knew?
Yeah, I think who would want to eat spaghetti all the time? Not that spaghetti's bad.
Okay.
But I'd like to mix it up a little bit, and I'd like to have choice. I mean, all of us would like to have choice. So if we could vary their diet and make them feel good about themselves because they've got a really nice smile that works, I mean, that does change people's lives. It makes life better for them.
Okay, so the next photo.
All right, the next photo.
And we are running out of time, but this is good stuff.
All right. Our next photo is a gal who has a few front teeth. That's it.
Okay.
They're hanging by a thread. She didn't know what to do. They were just about to fall out. Okay? And so in one visit, we went through, we removed those teeth, dropped in implants, and gave her a full set of teeth on top.
Wow.
And again, back to what you had mentioned earlier, I don't think you can tell. Those are natural looking teeth.
They do look nice.
I don't think you'd be able to pick out that those are not her own natural teeth.
And it's a full arch of teeth.
It's a full set of teeth in
like
one day.
Just hooked onto dental implants.
Yep.
Interesting. Well, it seems like everybody would want that. They wouldn't want something that comes in and out.
I think they would prefer to have teeth that stay in, that they can care for and work. But
this is another young-looking person, by the way.
This was a very young person and had no back teeth. And you could tell she kept fighting to keep that lip down to cover up that empty space in the back. And so for her, getting a full set just changed the whole deal. Let me show you this other woman. This is my favorite. This is a gal back in 1985. So she was unable to wear that lower set of teeth for 20 years. No teeth. Imagine going through your life without having a set of teeth to chew and function. I mean,
it's gotta be rough.
Or smile. No teeth, 20 years. So in one visit, we were able to drop in an implant and give her brand new set of teeth, both top and bottom. And the big thing is, that is a life-changing experience. And again, let's focus on the eyes. The eyes tell the story. It's totally different person.
She looks
younger.
different.
She's younger. She's younger looking.
And you can tell. Pretty smile, by the way, on that app.
That is.
I got to tell you something respectfully. I mean, I came into this interview, and I'm thinking, okay, dental implants, right? How exciting can this be? But this is good stuff.
Yes.
I think anybody at home watching this
Well, the magic is in the different. You make a difference. The nose and chin, all the relationships, the face, the whole symmetry.
That's a good point. Her chin now seems longer in the after.
Yeah.
Is that a chin implant?
No.
Combination of
No, it's just the function of putting implants and teeth in the right spot. And that's a 1 hour difference in picture. She still has the same outfit. And again, that was done 25 years ago.
Interesting. So eating and chewing, and so obviously 20 years without teeth, she's saying, I wish I would have done this years ago.
Absolutely.
Do you get excited? So you're on the consult, somebody comes in, they tell you they've been suffering. Do you, in your head, do you go, boy, this is going to be good?
Oh yeah, absolutely. No, you want to kind of hide a little bit of your enthusiasm because you get caught up in it, and you don't want to over.
Like you're selling something.
Yeah,
right?
you don't want to.
But
get
you
into
do
that.
get excited in your
Oh,
head.
absolutely. We get all jazzed up. We know what a difference it's going to make for them. It's just a wonderful thing.
All right, another one of your favorites.
My last, and a quick story. This was I got an opportunity
Perry
to work
Como,
with
right?
Perry Como, famous singer, and in this particular story, Perry had a partial. He was singing in Vegas. The partial flew out on the dance floor during one of his shows.
Floor?
On the show. And he tried to sing on, but he was used to having the partial, so the partial actually allowed him to sing. So he actually had to stop his band, walk over, pick up his partial, put it in, and on with the show. He promised himself then that later in life, when he quit singing professionally, he was going to get his teeth fixed. So we had the opportunity to work with him, and we started doing his implant treatment at 83 years old. And the reason I tell that story is because so many people tell me, I'm too old for dental implants. I'm too old to get my teeth fixed. With Perry, we didn't even start his teeth until he was 83.
You live in kind of a healthy area in Florida. Yep. 80 is young.
80 is young. I think 80 is young.
And there's a lot of denture wearers, and your message to them is, you're not too old.
Oh, you're not
Get
too
a
old.
fixed set of teeth.
Get teeth that work, that look good and work. Because that's what we want. We want teeth that feel good, look good, last a long time, that make us feel good about ourselves. And you get a proper social life and everything else. I mean, that's one of the spins on some of these things that, once they get their teeth fixed, the stories that they tell us after the fact of, my whole life changed.
Well, good for you. I want to thank you for coming to the show.
All right,
This
Randy.
was great info. Love your enthusiasm. They could go to the website, look at the photos. They could make an appointment to see you or your partner.
Correct.
You guys work together.
Yes, we do.
And you do a lot of the same stuff.
Yes,
for the
we
most
do.
part. All right. Well, thanks for
Okay.
coming on.
Thank
You've
you
been
for the
watching the
opportunity.
Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com, and you could put in Dr. Molzan. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.